nowadays we still have a relatively high rate of failed diagnosis of epilepsy. So I would say that we need to enable physicians and neurologists who are not specialized in epilepsies to distinguish non-epileptic seizures from epileptic seizures. We have to enable them to communicate about comorbidities and risks of epilepsy, such as sudden unexpected death in epilepsy. And this also refers to the nurses and EEG technicians. They need to get involved as well at the same time.
Well, for healthcare professionals, it is important to learn more about epilepsy, and especially in the field of neurology. During the last years, stroke was so prominent that a lot of neurologists didn't learn enough about epileptology anymore. And we, as the community of epileptologists, have to work on that and to better educate the general neurologists in the first point.
There are still many needs. I mean, the first really is that you should really try to achieve optimal seizure control, and that you should try to achieve normal living circumstances. A person with epilepsy should lead a life as normal as possible with respect to work, private life, hobbies, sports, and family planning. And in many countries, epileptology is still not so well taught. In some countries, it's still a separate discipline. So there are some people who know a lot about epileptology, but the general neurologist or the GPs don't know what to do and don't send patients to the specialists. So there are still gaps even in Europe, and not to mention other parts of the world.
I've decided to specialize roughly 20 years ago, and I'm not tired of it at all, because the epilepsies and treating people with epilepsies is very fascinating, because the symptoms that can arise from epilepsy and seizures are hugely variable. It's even sometimes surprising. So this is, we have the impression that we learn every day something new. It's always interesting. And then I like this gap between talking to patients and hearing their personal stories at the one hand, and at the other hand, to make use of very cutting-edge technologies to do diagnosis and treatment plans. So it's I would say, almost every time satisfying when you reach or you come to a consensus with the patient on treatment goals, and you try to work on these. Even if you don't achieve them, you work together with patients, and this is very satisfying.
I was fascinated by the disease. I was fascinated by the way, especially the staff at my center in Cork traditionally treated patients and their relatives, and therefore, well, more than 30 years ago, I decided to go for this specialty within the field of neurology.
I think epilepsy is a very interesting disease. So I mean, the seizures, what happens in seizures, the impact of seizure on the lives of patients is so complex, and it's very individual. So it's very there are no, of course there are standards, but the approach is very clinical. It's a lot about talking, understanding, history taking. So it's a very personal and individualized treatment, and you can learn a lot about the brain and human beings. There's this old saying that epilepsy is a good teacher. So you learn a lot about the brain. So it's really, for neurologists, I think it's a very fascinating disease.
To understand and to be clear of the fact that epilepsy is a clinical diagnosis. It doesn't rely on EEG or MRI or whatsoever. And that every day we should always seek to understand the different seizure types, because this allows to make epilepsy diagnosis at a very early level, for instance. So epilepsy is a clinical diagnosis. History taking is extremely important. So be well prepared, know the symptoms, and ask them.
Well, keep cool, have a strategy, have a plan B if plan A doesn't work, and communicate plan A and plan B with the patients so that they feel more comfortable concerning their future.
Well, I think one important advice is take time at the beginning. When you see a patient for the first time, when you make a diagnosis, it's very worth to really take time for a long history, for a complete history, for counseling the important aspects, because this is really the basis for a good and reliable long-term treatment. So the investment at the beginning might be an advice. There are really so many patients, and some of my patients I've known for really decades, and I'm often really very impressed by the way patients, particularly if they don't, if you become seizure-free after 2 seizures, then okay, no, yeah. But many of my patients have difficult epilepsies and still are very active in their lives and cope very well with their epilepsies. And when I have a clinic, I can always learn from my patients. And if I have enough time and listen to them, then there's a lot to be learned from the experiences.